So for me, unpacking complexity from a practice point of view, for me it was really about considering the relationships as they exist in a health system. If we think about the actual, going back to the definition of what complexity means, and complexity theory usually having to deal with the multiple components that exist in a system and the interactions within those components. And so in the social system, like a health system is, those interactions would be about relationships. I think that oftentimes when we've thought about governance and governance interventions, we've come really from the regulation perspective. So how do we regulate a system in order to be able to inform behaviors? And that is challenging because from the incentives perspective or from the institution's perspective, we're not always able to regulate behaviors. It's more helpful to start from understanding what the relationships are in a given setting and using that as the foundation of forming our interventions. If I give an example from Ghana, where we were looking at deployment policies, so how are health staff posted and transferred across posts. And what was quite interesting is that within the sector there's a very clear delineation in terms of authority, which levels of government have the authority to post particular cadres of staff, and everyone knows the policy. And yet you find that even though this policy exists and it's cascaded across levels of authority, depending on the relationships that staff have with higher level managers, they are able to open up negotiation spaces to avoid undesirable posts. This is important because it means that the policy alone, the regulation in this case, is not necessarily the whole way that the system is being governed. The system really is being governed through those relationships, but we have to understand why those relationships exist as they do. So part of that is the fact that the system isn't geared to favor the needs of the individual staff, but rather the needs and the goals of the system. And so it becomes what occurs in those negotiation spaces on the day-to-day that is really governing the reality of the posting and transfer system. So having an understanding of the relationships between staff and managers in this case is a more sound basis for intervening from a governance perspective than looking at the existence of those policies as they're cascaded across levels.